Forcier, and I have a medical degree from University of Connecticut, residency, University of Utah Pediatrics, and I've worked for a number of different Planned Parenthoods for 20 years. I do advanced contraception and abortion, as well as gender hormones, and sort of looking at the whole sort of schema of gender, sex, and reproductive justice.
So you've done a lot of work in this field. Could you just start by telling us?
Sure.
At what age can a child first begin to transition into another gender or identify themselves as a gender different from how they were born?
Yeah. Well, I mean, there's research and data that show that babies and infants understand differences in gender. Some children figure out their gender really early, and the reason why we say, oh, that's interesting or important is because they're figuring out their gender identity is not necessarily congruent with their sex assigned at birth.
When the doctor sees the penis and says, this is a male, has the sex of male, that's an arbitrary distinction?
Telling that family, based on that little penis, that your child is absolutely 100% male identified, no matter what else occurs in their life, that's not correct.
So what is gender affirmation care? You're a big proponent of. If we walk through, a child is sitting down with you, is questioning their gender. What's the gender affirmation process?
Affirmation means that as a pediatrician, as someone who says my job is to provide the best medical care for you, is I need to listen really carefully. And how I put it in words for kids so that they can understand it is, tell me your story. Where have you been in terms of your gender and your gender identity? Where are you right now? And more excitingly, where would you like to be in the future?
Have you ever met a 4-year-old who believes in Santa Claus?
Mm-hmm.
So this is someone who believes that a fat man is traveling through the sky on a flying reindeer at lightning speed, coming down his chimney with presents.
Yeah.
Would you say that this is someone who maybe has a tenuous grasp on reality?
They have an appropriate 4-year-old handle on the
Sure.
reality
Agreed.
that's very real for them.
Agreed. But Santa Claus is real for them, but Santa Claus is not actually real.
Yeah, well, but Santa Claus does deliver their Christmas presents.
Well, yeah, but he's not real, though.
To that child, they are.
When I see a child who, believes in Santa Claus, and then let's say this is a boy and he says, I'm a girl.
Mm-hmm.
This is someone who can't distinguish between fantasy and reality, so how could you take that as a reality?
I would say that as a pediatrician and as a parent, I would say how wonderful my 4-year-old and their imagination is.
Aren't kids famous for their active imaginations? Should we really let our children define reality? If I say that I feel a certain way, then obviously you can't tell me I don't feel that way.
Yeah.
But just because I feel that way, does that mean that it's true?
I mean, if it's your reality,
Yeah, if it's your reality
it's
too.
truly like none of my business who you
So we all have our own
identify.
realities? What if I said, I want you to say that it's true that I'm a woman? Would you say that?
Okay, you're a woman.
I would also say that.
If you want.
Yeah.
I honestly don't care. Like, whatever makes you happy.
What's true to you can be false to me. So like, it's like.
What if I said that it's true? My truth is that you don't exist. Does that mean you no longer exist?
I mean, if that's your truth, sure. I don't, because it's.
But you do.
Well, I mean, if you're saying that I do, then I do.
Well, but even if I said that you don't, you still do, because we're having this conversation.
I mean, are we?
I think so. I mean, I thought...
That's what you think.
Well, I should have known it would be hard to define reality in Hollywood. I should probably look to the place where truth is the foremost pursuit. The American University.
What we do in gender studies is not just reduce gender to what psychologists might call individual differences, but rather thinking about gender, and that's not women and man, but gender as a social form, something that kind of infuses itself into virtually all aspects of social life.
Let's talk about that then. I guess we should start with, we've got gender and sex, right?
Yeah.
What's the difference between the two? Is there a difference?
I saw that in your questions and I thought, my goodness, this is what we spend an entire semester kind of thinking through. But what we tend to think about in the social sciences today is that sex refers to a set of biological characteristics and gender is a social construct or category. What I think is often misleading about that characterization is allowed to be sort of messy and complicated. But in that framing, when you split them up into these wholly discrete constructs, studies scholars, and really more specifically people who study gender and sex, we're not talking about sexuality right now. In the kind of academic universe that I travel in is that we see how deeply gendered ideas, cultural ideas about masculinity and femininity, maleness and femaleness, both in humans and in lots of other animals.
So are gender and sex two different things, or?
Well, I think that they both are and they aren't. I'm comfortable saying that gender and sex are two different constructs, but they're deeply intertwined with each other.
We're talking about gender and sex, and there's a lot of controversies there. If we're talking about a trans woman has all of the male physical characteristics, so would that not be a male then? Couldn't we plainly say this person is a male?
Well, I guess it's like, why are you asking the question? I think I want to understand sort of why that's so important. So if someone tells you...
Just to sort of understand reality, you know?
Well, I mean, I think when someone tells you who they are, you should believe them. So if a person says that they're a woman or they're a man, then that's them telling you their gender is. I'm not so sure what social... interactions would have to do with maleness or femaleness that would.
Well, I'm not even talking about social context. I'm just trying to start by getting to the truth. You know.
Yeah, I mean, I'm really uncomfortable with that language of like getting to the truth again in social life.
Why is that uncomfortable?
Because it sounds actually deeply transphobic to me. And if you keep probing, we're going to stop the interview.
If I probe about what the truth is?
You keep invoking the word truth, which is condescending and rude. I'm saying to you...
How is the word truth condescending and rude?
Why don't you tell me what your truth is, and you're walking on 30 seconds more of thin ice before I get up.
What my truth is? Well, I don't think I really have a truth. I think that there's just the truth, like the reality. And so we should begin by trying to figure out what the reality is.
Uh-huh. And why are you concerned with when someone else tells you that they're a man, or even if they use the word male, why are you concerned with not believing them?
Well, you keep bringing it back to, you know, how do you respond in a social situation? But,
that's what I do. I'm a social scientist.
Well, right, but we're in a university. This is a place of understanding truth, isn't it? Or
absolutely. We pursue truth, and I'm a social scientist, and that's what I do.
But you just said the truth is transphobic.
That you would say, that if you're saying the truth is that I get to say, you're not a man, show me your genitalia, that's transphobic.
No, I don't want to see anybody's genitalia. I just mean someone can make a statement about themselves that could be untrue. Like, for example, if I were to say that I'm a black man, would you accept that, or would you be skeptical?
Are you black? Are you African American? Are you biracial?
I don't think so.
Okay, well, you don't look that, and I don't think it doesn't sound like that's a genuine statement of who you are.
Okay, so that's my point. I could make a statement about who I am that's incorrect.
Of course, I think it's well established that human beings can lie, yes.
Or not even lie. I mean, I could just be mistaken.
Yeah.
I'm not sure where you're going. I guess this all comes back, this all comes down to really one question. Especially women, gender, and sexuality studies. So what is a woman?
Why do you ask that question?
I just really like to know.
What do you think the answer to that question is?
Well, I'm asking. That's why I came to a college professor who's this is what you do.
What other kinds of answers have you gotten?
a lot of like this where you're not answering, and I've gotten a lot of that. So
I think it's interesting that you say that some of the people you've interviewed have been reluctant to answer it, and I think that has a lot to do with the questions that preceded it and the way that you've conducted yourself in the interview.
how have I conducted myself?
How do you think you've conducted yourself?
You just really don't want to answer the questions, do you?
I came today very willing and enthusiastic about answering questions about women and gender sexuality studies, which is
So
the
you
work that I
wanted
do.
you wanted to answer questions about women's studies, and so shouldn't the first answer you should be able to provide is what exactly is a woman?
Well, for me, it's actually a really simple answer, and that's a person who identifies as a woman.
But what are they identifying as?
As a woman.
But what is that?
As a woman.
Do you know what a circular definition is?
I do.
It's sort of like what you're doing right now, where a woman is a woman.
Mm-hmm. Well, because you're seeking what we would call in my field of work an essentialist definition of gender. I think it sounds like you would like me to give you a set of biological or cultural characteristics that are associated with one gender or the other.
I'm not seeking any type of definition. I'm just seeking a definition.
Yeah, and I gave you one.
Well, now I can say I've been to college. Glad I didn't pay for it. Is there anyone willing to give me a straight answer? Ideally, somebody with a bunch of medical degrees on the wall. Dr. Grossman, thanks for talking to us. You're a psychiatrist, medical doctor, and you've done a lot of work in child psychiatry. What is transgenderism from a psychiatric standpoint?
The best way to approach it is by speaking about gender dysphoria, which is an intense loathing and discomfort with one's biological sex. They exist anywhere between 1 in 30,000 people and 1 in 110,000. It's important to distinguish those people from what's happening much more recently, which is kids that never had any discomfort or dysphoria, as it's now called, with their biological sex. And then quite suddenly, as preteens or as adolescents, they come out and they announce that they are gender fluid, or they start to question their sex. So first, let's define the terms sex and gender.
Yes, please.
Sex is biology. Sex is unchanging. It's based on chromosomes. 99.999% of the cells in the body are marked either male or female. Gender, on the other hand, is a perception. It's a feeling. It's a way of identifying. It's an experience. Okay, that's subjective.
It sounds like what you're saying is that if a man is male but thinks of himself as a woman, he's not actually a woman?
That's correct.